Hello friends. Today we are going to discuss about post-traumatic stress disorder. Often, in short term, it is called as PTSD. I am Dr. Suresh Badadbhat, Professor of Psychiatry, working at NIMANS, Bangalore. Before I start my presentation, I would like to place a disclaimer. This presentation is for academic and training purpose only. If you want to have a clinical opinion, please do contact a psychiatrist. This video is targeted for practicing psychiatrists, doctors, nurses, social workers, psychologists, and students from various fraternity, along with that patient who is suffering from PTSD along with their family members. Let's discuss about post-traumatic stress disorder. PTSD is considered as a debilitating and often chronic psychiatric disorder that develops following exposure to a severe stress. And this severe stress may be experienced or witnessed. Historically, PTSD had various names. Initially, it was considered as shell shock syndrome or else soldier's heart. In World War I, it was considered as war neurosis, and in World War II, it was considered as combat fatigue. Later, the aftermath of World War II, concentration camp syndrome became the well-known diagnosis. But however, in 1980, first time in DSM-3, traumatic neurosis was introduced. That was PTSD was explained and described under traumatic neurosis. And later, rape victim syndrome was also explained in a rape survivor. So, PTSD often said that it is chronic debilitating because trauma it has occurred once or twice, but it is relived almost daily, every hour. That means once the trauma has occurred, and because of PTSD, that trauma occurs many times repetitively in the mind of the person who is suffering. Hence, a person who is suffering from PTSD, especially war veterans, for them, the war never ends. It happens in their brain very often. It may be every day, every minute. Imagine, they will be going through the same trauma which they had exposed physically, now they are going through mentally, and they have the same symptoms like panic attack, sweating, breathlessness, and becoming highly arousal. This kind of symptoms causes them to avoid those cues and stimuli which provoke these symptoms. Similarly, in rape survivors, the sexual assault has occurred. Because of PTSD, the assault which occurs repeatedly in their mind and which does not stop unless PTSD is treated. Hence, it is considered as chronic, debilitating because this trauma is relived many times in their mind. What are the core features? The core feature is despite the termination of the threat, that means the threat has already gone, but the survivor does not regain the sense of safety. For them, once a person who has gone through a war, example I can give you is if a soldier has gone to Vietnam War and he comes back, he is in a safe place. But however, he continues to relive the exposure he had in the Vietnam. That is considered as, although the exposure for threat and the threat has terminated, but he continues to have the threat perception. At the same time, the trauma is relived endlessly unless the healing is fostered. Here, the threat perception alarm becomes super sensitive. That means the alarm is triggered for a small cue inside or outside the environment. So this is the core feature of PTSD. Let's understand the PTSD concept. PTSD, although has been debated and has been highly controversial diagnosis, but however, it has been documented across culture, across various countries, and across continent. It is not a psychosocial construct similar to disaster survivors. It is a biological construct because the trauma which they are exposed brings in various biological changes in the brain and various parts of the body. Here, the common denominator is trauma. Because of trauma, the brain changes occurs, various endocrine changes occurs, immunological changes occurs. Of course, behavioral and cognitive changes are seen. Let's discuss about trauma. The reason being is the whole diagnosis of post-traumatic stress disorder revolves around trauma. Let's define trauma. Trauma has been defined by many people by various way. It has been used in colloquial way also. Here we need to be very specific, and what is the trauma has to be discussed, because trauma may be a financial trauma. Seeing something on television or a movie can be a trauma for some people. Some people watching a fight can be a trauma. A disaster witness can be a trauma. So what is this so-called trauma? That definitely defining is very essential. Trauma, what I am going to discuss, is severe emotional shock and pain caused by an extremely upsetting experience. This is what Cambridge Dictionary has given. Similarly, American Psychological Association says trauma is an emotional response to a terrible event like an accident, rape, or natural disaster. Here, the word is very specific. Terrible event. However, the widely accepted definition by SHMSA, that is Substance Abuse and Mental Health Service Administration from US Department of Health and Human Services, the definition of trauma is comprehensive. They have defined trauma results from an event or a series of events or set of circumstances that is experienced by an individual as a physically or emotionally harmful or threatening, and that has lasting adverse effect on the individual's functioning and physical, social, emotional, or spiritual well-being. So this is a comprehensive definition, and this has been accepted in US also. This definition I'll be using in this video. But however, the trauma response also depends upon the timing of the trauma and various domains it is going to happen. Hence, let's discuss about the response to trauma. Depending upon the timing, once the response is seen, it may be immediate response, or some people may have a delayed response. And also, the trauma, the domains are also essential. It will affect physical domain, emotional domain, cognitive domain, and behavioral domain. That means it is comprehensively affects the individual. Individual as a physical, emotional, cognitive, and behavioral. Let's discuss about the emotional reaction. Emotional reaction can be immediate or else delayed. Immediate, as soon as the trauma occurs, there will be shock, there will be denial, there will be anger, there will be depression, sometimes sadness, helplessness, feeling out of control, disorientation, feeling of numb, feeling overwhelmed. So these are the commonest early symptoms. But however, the delayed emotional response, which may be seen after 1 month or 2 months, it can be irritability, hostility, depression, severe mood swings, fear of trauma, grief reactions, shame, panic attacks, emotional detachment like derealization, depersonalization symptoms. So these are the commonest immediate and delayed effect. Further, you can also know that these emotions can be extreme in PTSD. Either it will be zero, completely numb. The person who is experiencing PTSD with complete numbness or unable to feel anything is at one end, or else on the extreme emotional distress like severe panic or else severe irritability, frustration leading to combativeness. So you can see the extremes of emotion in PTSD. Further, certain physical reactions also can be seen, such as soon as the trauma occurs, the person may have nausea, vomiting, sweating, shivering, feeling faintness, extreme fatigue, exhaustion, startled response, depersonalization phenomena. So these are commonly seen as an immediate physical reaction. Delayed physical reaction, 90% of them will have sleep disturbance, nightmares, somatization, that is unexplained physical symptoms, decrease in appetite, definitely various changes in the gastrointestinal with regard to digestion, lower resistance to cold, infection, elevated cortisol levels, hyperarousal, long-term health effects like hypertension, diabetes, and various illnesses can be precipitated. These are the various physical reactions. Coming to the cognitive reactions, that means especially with regard to brain functioning, difficulty in concentration, ruminating the same thoughts many times, constantly worried, constantly preoccupied, distortion of time, distortion of feeling something is going wrong around, memory problems, difficulty in remembering things, and also strong identification with the victims. That means I'm responsible for the death of people. I'm responsible for the suffering. Sometimes delayed cognitive reactions also seen. For example, intrusive memories, flashbacks, reactivation of the previous traumatic events, reliving the traumatic events, self-blame, guilt, delusion of guilt, preoccupation with the event, difficulty in making decisions, magical thinking, belief that feeling of memories are dangerous, and if these repeats many times, that means I'm losing control, I am becoming mad, I'm becoming crazy, suicidal thinking, deliberate self-harm. So these are the things which commonly seen because of the cognitive reactions. Further, you can also see certain cognitive distortions, like with regard to the world, they may have world is dangerous place, all men are rapist, especially in rape survivors, people are not untrustworthy, people are violent, why my family? So this is with regard to the outside the person, that is with regard to the world. Coming to the self, I am bad, I am useless, I am responsible for the death, I am responsible for the suffering, I am responsible for the country's loss, I am worthless. Why me? So these are the cognitive reactions or distortions seen in PTSD patients. Further, there are behavioral reactions. These are easily absorbable. In the immediate response, there will be startled response, disorientation, restlessness, sometimes argumentative, becoming irritable, combative, violent, withdrawal, at the same time apathy, avoidant behavior can be seen. Delayed reactions, behavioral reactions can be seen are in the form of avoidance of the event reminder, social relationship disturbance, social withdrawal, decreased activity level, increased use of alcohol and drugs. This is commonly seen during disaster. Whenever the disaster occurs, the survivors are placed in the relief camps. There you can see increased consumption of alcohol and drugs. Because these are used as a self-medication to cope with the disaster loss. Sometimes being withdrawal is the various behavioral reactions can be seen. The extreme form is suicidal attempts and suicide. Coming to the existential reactions, this is what the spiritual reaction you can call it as, but here the existence is intense, sometimes immediately intense use of prayers, restoration of faith in goodness of the others, telling that okay, because of God I survived. Sometimes opposite may happen, that is to the extreme. The God is very bad. How can the God can kill everyone? Or else how can the nature be so cruel? Or else despair about inhumanity and also becoming very angry and why should be alive? And the whole administration is completely wrong. Or else questioning the goodness, humanity, and also these are the various existential reactions can be seen. Delayed existential reaction can be why me, why my family, why my community, sometimes loss of purposeness, sometimes hopelessness, worthlessness, sometimes God is not there, I don't believe in God, and start hating God. So these are the existential reactions commonly seen in persons who are suffering from PTSD at the same time when a person undergoes severe trauma. Let's understand the different types of trauma, because till now we discussed about the response to trauma, we have discussed about the definition of trauma. Now it is time to classify. Depending upon the time, it can be acute, single, that means one episode of trauma and it is only single. Sometimes chronic sustained, especially financial trauma, sudden loss, that is one, or else severe domestic violence which is occurring almost daily basis, that is chronic trauma. Complex, it is repeated, child sexual abuse can be, or else ongoing war, that's one. So these are the various classification with regard to time. Depending upon the survivors, primary survivor is a person where he has experienced this trauma directly. Secondary survivors witnessed the trauma indirectly, that means they watch the trauma occurring in front of them. They are not actually the primary victims or the primary survivors. They actually witnessed it. Suppose a person standing on the footpath watched an accident in front of him where a elderly man was crushed to death by a lorry. So he becomes a secondary survivor. The primary person who died will be considered as, if he survives, he will be considered as primary survivor. Coming to the trauma survivors, depending upon whether it is individually, the whole family is a survivor, community, or else the mass, or example is pandemic. So here in the pandemic, COVID pandemic, the survivors is the entire global humanity. Depending upon the trauma frequency, it can be primary, secondary, or repetitive. Primary, especially in case of rape, the actual event is considered as primary trauma. Secondary is re-victimization of the survivors. When the society, the family members, friends may start telling that she deserved it, and stigmatizing and discriminating is secondary re-victimization, or else repetitive, especially with child sexual abuse. Depending upon the experience, trauma also can be classified as in-person or virtual. If you are seeing the trauma by your own eyes or experiencing it, it is called as direct. Virtual means watching on the television or else by a virtual mode. Coming to the trauma being expected, whether it is expected, unexpected, intentional, unintentional. The words explain. Expected means, especially if a person is suffering from cancer, that means he's going to die. That is expected. Unexpected is sudden road traffic accident. Intentional, unintentional. Intentional is terrorism, where a person deliberately comes and kills the people. Unintentional, road traffic accident. Coming to the etiology of trauma, it can be natural, like floods, earthquake, or else heavy rain leading to floods, or super cyclone. Man-made, that is terrorism. So these are the various classification of traumatic events can be seen. Further, there is a difference between natural versus man-made disasters, or else trauma. With regard to natural, since it is a nature is creating havoc in the form of tornado, lightning, avalanche, earthquake, hurricane, floods, tsunami, famine. Here, though there is a trauma, but it is universal in that society or in the community. Hence, the sense of loss will be common and the PTSD symptoms will be almost similar and lesser. Whereas with regard to man-made catastrophes like terrorism, maybe riots, road traffic accident, gas explosion, or else even war, or else homicide. So these are the places where the PTSD symptoms will be very high. Moving to the impact of trauma on any individual. Here we can see a person, and the person's constitutional is genetic makeup, temperament, childhood traumas, or else birth asphyxias, genetic disorder, or else heritability of any illness will constitute constitutional makeup, that is internal. Whereas outside, the trauma occurring from the environment or else man-made. Along with this, what are the protective factors like interpersonal and family support and social and economic support? All these will shape up the response to PTSD. Let's understand what are the factors playing role in PTSD. There are three important factors: risk factors, the factors surrounding trauma, and the post-trauma. Risk factors, basically genetics, gender, birth asphyxia, childhood adversity, substance use, and temperament. So these are the risk factors which have been identified. With regard to trauma, the severity, the dosage of trauma, the duration, how long it occurred, how repeatedly it occurred, and also whether it is predictable, unpredictable, whether it is a man-made, that is human cause. Coming to the post-trauma, family support, social support, ongoing stressors, economic problems, and comorbidity along with PTSD. All these will shape the response and also the course and outcome. Moving to the impact of trauma on mental health. Let's understand, if there is a trauma, it not only affects and causes PTSD, it also causes a series of stress-related disorders. They are acute stress disorders, also called as acute stress reaction, adjustment disorder, reaction to severe stress, reactive psychosis, reactive attachment disorders, dissociative disorder, somatoform disorder, burnout, and neuroanesthesia. So these are the various disorders which have been identified under ICD-10 and DSM-5 also. That means stress not only causes PTSD, it also causes various other disorders. Stress and trauma are interchangeably used in PTSD. And you can see trauma can precipitate various mental illness such as substance use disorder, bipolar disorder, psychosis, depression, various other anxiety disorders, and personality changes. And if it occurs in children, temperamental changes, and it will have a direct pathoplastic effect on the development of personality can be seen. Let's discuss about these PTSD symptom dimensions. There are 5 important PTSD symptom dimensions. First one is traumatic event, which is severe. Second one is re-experiencing that trauma after the traumatic event has ceased, but he is re-experiencing in his mind. Second one is arousal of symptoms whenever he is re-experiencing. At the same time, avoidance of those cues which triggers this re-experiencing phenomena. Finally, altered mood and cognitions because of the repeated exposure to this trauma in his own mind. Along with this, this event is very essential along with the human body and susceptibility, vulnerability, and genetic makeup that is considered is very essential for a triggering of PTSD. Let's discuss about the traumatic event. Traumatic event can be through direct or indirect exposure. Direct exposure here, the person should be undergoing trauma by himself, that is primary survivors, or else he is witnessing the primary survivor directly in person, that is directly witnessing, is very essential for diagnosis. But however, indirect exposure is allowed only in the first responders with regard to trauma. Examples, doctors, nurses, or else ambulance drivers or the ambulance healthcare personnels can be considered as indirect exposure. That is with regard to traumatic experience or an event. Coming to the re-experience. Re-experience, there are 2 important. One is external cue or internal cue. External cue, which are related to, for example, which are related to an accident, like articles, maybe a car, maybe sound, smell, picture, color of the car. Those external cue can trigger re-experiencing event. Or else internal cue, suddenly he starts remembering about flashbacks without his knowledge. He starts getting those thoughts, images, sometimes nightmares, repeated memories, and repeated images, auditory imageries. So these all cues can trigger re-experiencing or reliving the whole trauma event is seen. Coming to arousal, suddenly the person becomes having startled response. Startle means jumping out of his own skin, is called on the edge, being anxious, insomnia, severe panic attacks, impending doom of death, hyperventilation, tremors, shaking. To that level, he feels that he's going to have an heart attack. So that is arousal. With regard to, because he is having this re-experiencing and arousal, it's a very uncomfortable situation. Hence, he wants to avoid certain things which will trigger this. It may be avoidance behavior, withdrawn behavior, not meeting any family members, staying in a room, does not go and meet any people in the society, avoiding friends, avoiding the work, because if he goes to work on the road, he may see the car, red car, which may trigger the whole re-experiencing phenomena which he had met with an accident. Avoiding triggers, avoiding physical sensation which may trigger is called as avoidance. So there will be a severe avoidance in PTSD. And coming to altered mood and cognition, numbness, frozen emotions, that is very common, irritable, anger outburst, combativeness, sadness, frustration, and fear. So which we have discussed in response with regard to trauma. Coming to the summarizing the whole phenomena, every trauma is processed and forgotten. That is common in normal people. But however, in certain people, there is failure to heal from the trauma, and that leads to reliving, re-experiencing the trauma many times in a day, provoking arousal. At the same time, anxiety, panic attacks, avoiding those cues will lead to psychological wounds which are not healed, and that causes severe symptoms in PTSD. Let's discuss about the prevalence of PTSD. How common is this PTSD? Is it very common in general population, or else is it common in certain population? Let's discuss about that. Prevalence in general population. Across the world, the studies have said that 70% of the population has been exposed to one or the other life event or a trauma. And however, only 6 to 8% of the population will develop PTSD in their lifetime. These have been replicated in various studies. However, US National Comorbidity Survey replication study clearly said that lifetime prevalence of PTSD in US population is 6%. Men will suffer around 3.6%. women will be 9.7%. This is about the lifetime prevalence. With regard to 1 year prevalence, 3% of the population is suffering from PTSD. Men being 1.8%, women having 5.8% 1 year prevalence. Coming to the prevalence in high-risk population, that means who have been exposed to severe trauma, like natural disaster, 5 to 23%, man-made disaster, 21 to 60%, ambulance person, 10 to 15%, war veterans, 20 to 25%. You can see there is a huge range. The range is dependent upon the type of trauma, whether the trauma was expected, unexpected, whether it is a natural or else human-made, or else the way the diagnosis is done and the timing of the diagnosis. All these will lead to variation in the diagnosis of PTSD. Now, move into PTSD in India. How common it is in India? National Mental Health Survey done in 2014 and 15, it could not find major PTSD. That means even if you take all anxiety disorder, that is only 3.7%. All anxiety disorder included simple phobia, social phobia, agoraphobia, OCD, and various other anxiety disorders. That means PTSD is less than 1% in Indian population. Again, 1% less than what I am telling you is the my estimate. However, we don't see PTSD very often in our clinical practice. Coming to the high-risk population, PTSD studies done in natural disasters like floods, cyclones, tsunami, and earthquake. Not more than 5%. I have worked in tsunami and also in Uttarakhand, that is in the flash floods. Again, the studies have clearly said that PTSD is very uncommon in Indian population, for that matter, even in the Southeast Asia. We don't know what are the reasons. But however, man-made disasters in India are army exposed to war, or the attack by the terrorist, road traffic accident, sexual assault, rape, child sexual abuse, violent crimes, burns, fire tragedy, dowry harassment, dowry death, stampede, riots, especially religious riots, orphans. Around 30 million are waiting for the adoption. That means these children are left abandoned and they are in the various orphanages. So again, you should have seen more PTSD here. But however, we don't see. Mumbai terrorist attack studies have shown that they are very less in India. Terrorist attacks which have been very ongoing and relentlessly the terrorists are attacking in India in various parts, armed conflicts, domestic violence, geopolitical violence. There are various number of traumas which are occur in India. But however, the studies in India shows the PTSD is very less. Even one of the best scientists and also a clinician, Margoob et al., studies done in Kashmir also said that the cross-sectional PTSD is 7%, lifetime is 15%. However, there was a recent study done from Kashmir and published in BMJ Global. It was a large study covering 399 villages, 10 districts, and 5,600 households was carried out. And they also could not come to the exact number of PTSD diagnosis. They said 19% probable PTSD diagnosis. Again, they've used the word probable. That means PTSD diagnosis in India is very less. Why? We don't know. But however, there is a contention. No, it is not possible. Let's be very practical and ask yourself, how many PTSD cases you have seen in the past 1 week? How many PTSD cases you have seen in the past 1 month or in the 1 year, or else in your clinical practice, how many PTSD cases you have seen? That means it's very less in India. If they were common, you would have seen almost daily one PTSD case. But that's not the case. Even in tertiary centers, PTSD diagnosis is rare. That means there may be various possible reasons. Because in India, the commonly used is ICD. Whereas in US and Western culture, DSM is used. And there are many studies clearly said that diagnosis of PTSD by using ICD-10 is very difficult. Whereas DSM, it is very easy. That means diagnostic criteria may be playing a role, possible. And also the rights-based and social justice societies, especially US and UK, may be one of the reason the PTSD is very high. Or else insurance-based. That means here the whole treatment is paid by the patient, especially in the developing countries. Whereas If you look at the US or Western countries, it is insurance based. Unless there is a diagnosis, the treatment cannot be given. That means even a subsyndromal PTSD symptoms will be diagnosed as PTSD. That means because for the requirement of health insurance. That is one possibility. Compensation based. If you have developed PTSD, that means mental health compensation. You will get a huge compensation because of the mental trauma. That may be the reason, which is not there in India or else in the Southeast Asia. Poor social and family support in Western countries may be the reason for increased PTSD, but in India, we have a good family and social support. However, in the urban area, there has been increased nuclear families. Along with that, social, cultural, and educational, the expression of distress also matters the most. Here in India, we allow and also we help them to express their expression, especially in women. Coming to the possibility, one is maybe Southeast Asian population is genetically different from the Western population. So these are the various reasons have been attributed to the less PTSD in Indian population or else in Southeast Asia. But exact reason, I don't know. It requires to be researched. And it requires a huge population study comparing between the Indian population and the Western population. To conclude, my dear friends, PTSD is present in all culture, across various countries, across the continent, and it can be easily diagnosed using DSM-5. PTSD is a biological construct with severe traumatic event having a direct impact on the brain and also on the endocrine system and immune system. Early diagnosis and the treatment is the only way to address the PTSD. Do not forget to address comorbidity, differentiating with various other disorders. Thank you very much for your valuable time. Stay safe.